Have you ever wondered how our lives would be if the COVID-19 pandemic never happened? Let's turn back the clock to late 2019. In a bustling seafood market in the city of Wuhan, China, something unseen was beginning to stir. A new virus, part of the larger family known as coronaviruses and soon to be known as COVID-19, was making its first leap from animals to humans. Before long, the first cases of a mysterious pneumonia-like illness were being reported. Health professionals were puzzled, the public was curious, and the virus was relentless. It didn't take long for the World Health Organization to catch wind of this new adversary. As the new year dawned, so did the realization that we were dealing with a novel coronavirus. The World Health Organization was quick to respond, issuing guidelines and advisories. The organization was like a lighthouse in a storm, guiding a world that was grappling with the unknown. But even with this guidance, the virus continued its silent, relentless march across the globe. As the virus spread, so did fear and uncertainty. Borders were closed, flights were cancelled, and cities were locked down. The world watched in collective apprehension as everyday life was replaced with the eerie quiet of deserted streets and closed shops. From the bustling streets of New York to the scenic canals of Venice, the world was falling silent. The global reaction was a mix of disbelief, fear, and a budding determination to overcome. The virus was not just a health crisis. It was a test of our resilience, our unity, and our ability to adapt in the face of adversity. The world was in for a drastic change, one that would challenge our way of life and resilience. As the virus spread across continents, so did fear and uncertainty. It began as a whisper, a mere murmur in the vast expanse of global chatter. But as the virus took hold, that murmur grew into a roar. Borders were sealed, flights grounded, and cities that once bustled with life fell eerily silent. The world had gone into lockdown. From the crowded pavements of Paris to the isolated islands of New Zealand, the response was swift and decisive. France, witnessing the easing of the fifth wave, lifted restrictions on sports and cultural venues, while New Zealand started phased border reopenings. In the United States, preparations were underway to vaccinate children as young as 6 months, pending emergency use authorization. Yet, the virus was no respecter of borders or regulations. It slipped through the cracks, hitching a ride on unsuspecting travelers, infiltrating communities. In response, countries tightened their border controls. Taiwan, Hong Kong, Japan, all added countries to their lists of high-risk areas due to the emergence of new variants. But amid the fear, uncertainty, and tightening restrictions, there was defiance. A couple in the Netherlands was arrested for fleeing a quarantine hotel. A woman in Australia was charged with arson after allegedly setting a quarantine hotel on fire. These acts of rebellion, while dangerous, spoke to the desperation and frustration felt worldwide. As the virus continued its relentless march, the data painted a grim picture. Unvaccinated individuals were 97 times more likely to die from COVID-19 compared to those who were vaccinated and boosted. A stark reminder of the importance of vaccination in this global fight. Meanwhile, the world's leaders were not immune. President Biden, despite being fully vaccinated and boosted, tested positive for COVID-19, sending shockwaves through the global community. His diagnosis served as a sobering reminder that no one, not even the most powerful, was safe from this invisible enemy. With the world in lockdown, the race was on to find a solution to this global crisis. In the midst of the crisis, the world turned to science for answers. The path to developing a vaccine is an intricate one involving several stages of research, testing, and approval. Typically, this process takes several years, but in the face of a global emergency, scientists achieved the extraordinary. They accelerated this journey, condensing years of work into mere months. This swift response was made possible by prior research on similar viruses, international collaboration, and the advent of new vaccine technologies. It was a race against time, but science was up to the task. There are various types of vaccines developed to combat COVID-19. Some, like the Pfizer and Moderna vaccines, use messenger RNA or mRNA to instruct cells to produce a harmless piece of the virus, triggering an immune response. Others, such as the Johnson & Johnson and AstraZeneca vaccines, use a harmless virus to deliver a piece of the coronavirus's genetic material into cells to stimulate immunity. But creating the vaccines was only part of the challenge. The next hurdle was distributing them globally. Vaccines needed to reach every corner of the world, from bustling cities to remote villages. This required a massive logistical operation involving governments, international organizations, and the private sector. In record time, billions of vaccine doses have been administered worldwide. These vaccines have shown to be highly effective in preventing severe disease, hospitalizations, and death. They've become our most powerful tool in the fight against COVID-19. Yet it's important to remember that while vaccines have brought us a long way, they are not a magic bullet. Vaccine coverage is still uneven across the globe, and new variants of the virus continue to emerge. Vaccination is a crucial step, but it is just one piece of a larger public health strategy. The vaccines brought hope, but the battle was far from over. Just when things seemed to be looking up, the virus had other plans. This line is not just a dramatic punch, but a harsh reality we faced, signaling the arrival of new variants of the virus that caused COVID-19. The first to make headlines was the Delta variant, a highly infectious strain that swept across the globe, causing a dramatic increase in cases. It was not only more contagious, but also showed signs of causing more severe disease. Health systems worldwide were once again strained, trying to cope with the influx of patients. But the virus wasn't finished. As if in a twisted game of chess, it made its next move, introducing the world to the Omicron variant. This variant, first identified in South Africa, carried a high number of mutations, sparking fears of increased transmissibility and potential resistance to vaccines. Countries responded swiftly, imposing travel restrictions and tightening border controls. Taiwan, Hong Kong, Japan, and even the United States, to name a few, altered their policies in response to the Omicron variant. These actions, while necessary, further complicated the global effort to return to some semblance of normalcy. What was even more concerning was the uncertainty that these new variants brought. Each variant carried a question mark. Would the vaccines still work? Would the symptoms be more severe? Would our health systems be able to cope? These questions hung in the air, adding a layer of anxiety to the already tense situation. But alongside the anxiety was resilience. Scientists worked tirelessly, studying these new variants, determining their characteristics, and assessing the effectiveness of current vaccines against them. The global community was not backing down. Instead, it was adapting, learning, and fighting back. The arrival of these new variants showed us that the virus was capable of changing, of throwing new challenges our way. But it also showed us something else, our ability to rise to these challenges. The pandemic was indeed an ever-evolving crisis, but so too was our response to it. The new variants proved that the pandemic was an ever-evolving crisis. But remember, so are we, ever-evolving, ever-adapting, and ever-resilient in the face of adversity. And now that we're here, what does the future hold for us? As we stand at the cusp of another year, the global situation regarding COVID-19 continues to evolve. The ongoing vaccination efforts are a testament to the power of scientific collaboration and human resilience. Countries across the globe are working tirelessly to ensure their citizens are protected, with measures including providing masks, rapid antigen testing, and COVID-19 test kits for large-scale events. But the task is far from over. Despite the clear benefits, many people have not received booster doses. Public health experts emphasize the importance of data and public understanding in this regard. Data from the CDC shows that unvaccinated individuals are 97 times more likely to die from COVID-19 compared to those who are vaccinated and boosted. The development of new treatments is another beacon of hope. For instance, President Biden, after testing positive for COVID-19, despite being fully vaccinated and boosted, started taking the antiviral drug Paxlovid, illustrating the ongoing efforts to manage and treat the virus effectively. As we look forward, we also grapple with the arrival of new variants, such as the Omicron variant, which has led to tighter border controls and increased vigilance worldwide. But amidst the uncertainty, a South African doctor who treated Omicron variant cases reported that the symptoms have been mild, a glimmer of hope as we continue to learn more about this new variant. So what does the future hold? Experts are cautious, yet optimistic. It's a race against time, a balance of vigilance and adaptation. While the situation continues to evolve, the focus remains on vaccination, developing new treatments, and maintaining public understanding and cooperation. While the future remains uncertain, one thing is clear: our resilience and adaptability will see us through. This pandemic has been a test of our global resilience, and through science, cooperation, and adaptability, we continue to navigate this crisis. The road ahead may be long, but as history has shown, humanity has the strength to overcome.